look around you, do you see what I see?
Our first speaker today, I'm going to read her bio, is Teresa Broering, who is a licensed clinical social worker. And Teresa is the director of care management at Aging Well Elder Care, one of the oldest and most respected aging life care management practices in the Washington, D.C. area. So, Teresa holds a master's degree in social work with specialization in aging from SUNY Albany. And Teresa brings over 11 years' experience in care management at Aging Well Elder Care. She has expertise in supporting clients with complex aging related illnesses, mental health challenges, intellectual and acquired disabilities, and complicated family dynamics. Teresa has played a pivotal role at Aging Well Elder Care, including direct client care, providing staff supervision, and helping create the Debbie's Angels Concierge Companion Program in 2013. She regularly collaborates with Bree Baldwin, who has an MS in gerontology, and Yvonne, who also has an MS in gerontology, who head the Well Senior Program, which was the reason I initially asked her to speak today. So the Well Senior Program provides a safety net for solo agers as they need more support. In her free time, she enjoys really good TV shows, movies, anything Taylor Swift, a Swiftie, oh boy, and spending time with friends, family, and her cats, Duke and Lila. So she has a presentation for us. It's going to take about 12 to 13, 14 minutes. And I'm going to be watching the chat, and we will take questions at the end of her presentation before the next one. Okay, take it away.
Thanks so much, Kathleen. I really appreciate the intro. And let me share my screen here for everybody. Get these meeting controls out of the way that you can't see. All right. So as Kathleen said, I'm the director of care management at Aging Well Elder Care. Really nice to see everyone here. I saw some familiar faces and names. I can't see anyone now. So when you are, if you have any questions or anything like Kathleen was saying, please put them in the chat so she can read them out loud. And I think we're going to have some time afterwards for some question and answer. There'll be another slide at the end with my contact information. But today we wanted to talk a little bit about our program. But first, we have a pet appreciation slide. So we have two cats over here. This is Duke on the left and Lila on the right. So hopefully that'll kind of get everyone primed for some happiness as we talk about some somewhat challenging topics of conversation. So as Kathleen was saying, Aging Well Elder Care we're a pretty large care management practice in the DC metro area. A lot of you might have known us formerly as Deborah Levy Elder Care Associates. We've been around since 1988. We have nurses, social workers, gerontologists, and an occupational therapist on staff. And pretty much every day, we're providing expert recommendations and individualized support to clients and their families regarding the challenges of aging and disability. We are all members of the Aging Life Care Association, and that association promotes and leads the community of aging life care professionals, formerly known as geriatric care managers, through our unique knowledge base, continuing education, professional development, and very high ethical practices. So that can just give you an idea of the kind of baseline that we're working with. So today we're going to really dig into the Well Senior Program. We're going to talk a little bit about care management in general, and we're going to try to focus this on, how you as solo agers or the people you know as solo agers might use some of this information to help benefit them. So I can't actually see your hands, but I would love for you to raise your hand if you've pre-planned for your future, and maybe someone can call out how many people might be raising their hands.
I can.
Yeah.
We have 2 of 17 so far.
Fair. Fair. And so this leads me to believe that some of you may benefit either from the Well Senior program or the ideas that are associated with it. And so we based our Well Senior program around the idea that there's a lot of very well seniors out there in the DC metro area who may need to do some pre-planning, maybe already have done some, but are looking into more of it, and who are also potentially aging solo. Aging solo might look different to each person. We see a lot of people where they have children, maybe they're local, maybe they aren't, and those children either aren't interested or aren't able to provide support to our individual clients if they were to have a medical emergency. There's also plenty of individuals that don't have children in this area and maybe have a really good group of friends, or perhaps, some brothers and sisters who could assist, but who also have things going on in their own lives that may complicate their ability to react if there were an emergency. So the ideal person looking at the Well Senior program is someone who's really wanting to plan for potential future care needs. They don't have any right now. They're wanting to plan for those future care needs. And it's especially appropriate for, like I was saying, people who are concerned about the reliability of their local support system. And so just to give you an idea of what the program entails, basically you would call our office to do an intake. We have an intake process that's free to you. We kind of talk through all of the things we can provide. Maybe through that process, you learn about another program we have that you might be interested in. Maybe at that time you realize that we're not a good fit and we can help direct you to other companies that would be a better fit for you. The Well Senior in particular, after you enroll, you do an initial assessment, and that involves getting all of your information, as much medical information as we can get, psych-soc information, which in the world of social work is a fancy word to basically discuss the psychological and the social aspects of your life that are very important to you. We get all of your important contacts into our system. We talk about things like medical and financial power of attorney, any other services you currently have or professionals you're involved with. Maybe you already work with an elder law attorney regularly. Maybe you have a financial advisor that you work with. We make sure to have all of these people in our system, of course, to then be able to help pull on those professionals you're already involved with if you were to have an emergency. After that initial assessment, we do quarterly phone calls, basically just to check in. How are things going? Tell us, have you had any medical changes? What's new in your life? We update our system during those quarterly phone calls. And then an annual in-person visit that is required so that we can really just kind of keep an eye on things. We can visually see if we're noticing changes with you that sometimes people don't notice themselves. And we go through all of our system again and make sure everything's updated. Now, the purpose of doing that is so that we can react in case of an emergency. And in the case of an emergency, by being enrolled in our Well Senior program, you will then be streamlined directly to start receiving care management services. Now, that's important because if you come to us today with an emergency that you're hoping we can start working with you on today, there's probably going to be a wait. Right now, it's probably a couple weeks at least before we can assign someone and get them out to your house and start helping. Maybe you're in the hospital. It's going to be a little bit of a wait for that in-person support. By being a Well Senior, we pull from our existing staff to make sure you immediately have somebody to assist. And so that differentiation comes where you've been a Well Senior, you're in our system, we're in the loop about what your baseline is. And now let's say you've broken your hip. Something happened. We actually had a client call us just this week. He was outside doing stuff with Christmas lights that his wife had asked him not to do. And he slipped and fell, and he had a complex fracture of his femur very close to his hip, and he needed surgery. So from that point on, we jump in to start providing care management. So all of these quarterly calls and things that we've been doing through Well Senior, we're now jumping into the kind of the crisis intervention mode. And these are all things, reasons that Well Seniors might call us and where we might start providing ongoing care management. So that includes any kind of crisis or emergency, any hospitalization, any new diagnosis, or any need for medical management. We have unfortunately, a lot of Well Seniors who call us and say, got a cancer diagnosis, want you to be in the loop and actually think that you benefit me for you to be at appointments from now on. Any life transition, whether that's, the death of a spouse, the death of another family member, where maybe you're changing your priorities, maybe you're looking at moving. We can help navigate that and see, help you think through what's important and what you want to do. Of course, dementia is a big one. People develop it over time, potentially. Sometimes people, spouses might join with us and one person has mild cognitive impairment, the other person has no diagnoses, and over time that mild cognitive impairment is worsening and becoming, kind of manifesting in different ways. And so we'll help the spouse navigate that by jumping in to provide care management. Any sort of disability we can help with. We see a lot of different things, anywhere from, like was mentioned, developmental disabilities. For a lot of times for Well Seniors, we have some who have adult children with developmental disabilities. And other times they've acquired a disability of some kind. And we've had a Well Senior on our in the program for a while who actually has had MS for years. And so he's been just checking in, and then eventually things did progress. And so we needed to jump in to provide that care management support. These are the areas that Aging Life Care Manager can help you. So when we're looking at both the Well Senior and the regular care management services, we're looking at all of these areas of your life. So that includes crisis, health and disability, financial, housing, family, local resources, advocacy, and legal. And this is a great visual to see how complicated it can become as soon as you have a major medical setback. So this is a mind map created by David Soli, and it's called When the Bottom Falls Out. Because when you have a major medical setback, you suddenly are thinking about all of these things, and all of these things are what care managers can then jump in to help navigate. And I think I'm probably running low on time here, right? Maybe about 3 more minutes?
About 5.
5, okay.
4.5.
Okay. So we can kind of dig into this a little bit more. Let's say that you are a Well Senior, and actually let me go to my next slide to kind of see where I'm at. So you're a Well Senior, and let's say you've been working with us for 4 years. You don't have any children. You and your spouse are both enrolled in the service. You have a really good group of friends and some local siblings. And you've just been cruising. Life's been good. You've been traveling. You've been keeping us updated. But something's happened. Say you went in for a normal checkup, you got some blood work, and you found out that you now have a blood cancer. So you've got this major medical setback. There's a lot of questions that you're going to start to consider to see, what am I going to do next? One of the first questions you might ask yourself, and luckily something that we would have already prompted you to think about in the Well Senior program, is, are there advanced directives? And we'd look at this and we'd say, yep, you've got them. Now let's look at them. Are they up to date? So we might talk through that. Maybe they're about 10 years old. Maybe you're a little worried that the decisions you would have made for yourself 10 years ago wouldn't apply anymore. And so we'll help talk that through and see for your individual circumstance what makes sense for you. Let's see, there's this other consideration here. So maybe the type of cancer you've been diagnosed with can cause a lot of exhaustion and being tired, and you live in a 3-story home. So this question here is, what happens if you're disabled, and can you stay in your current home? So that's something that you'd really have to start to think about, and something that might be really hard to think about when you're already stressed about this medical diagnosis and maybe you're needing to go through some treatments for it. And so we can really help just lay out for you what are the options in this local area. What would a home modification look like? How much might that cost? Get you connected to providers that could do those modifications so you could really see how much the cost would be and whether it's something you would want to do. And then also look at what are the local, potentially assisted living options? What are the local assisted living group home options? If you go to the hospital, what hospital would you want to go to, and what rehab might you want to consider? And that's something, that we'll be talking about later today as well through the future speakers we've got here. So there's so much to consider. Like those two things we could spend hours talking about. And people do. And sometimes they really need to just talk through what they're thinking, how they're considering their options, and also talking about why it's important to them. We're happy to talk through those things so that you can make the best decision for you. The other consideration down here, maybe you feel like you've been really set financially for what you're living, for what your circumstances are right now. But what happens when you're needing to potentially consider assisted living care or a major house modification? And what happens if you run out of money? And maybe we're needing to connect you with an attorney who can do some Medicaid planning, which potentially is something you've never had to consider before. And so now you're really having to think about things again, on top of the stress of the diagnosis, on top of the stress of the fact that you need to update your POAs, on top of the stress of just generally thinking about that you might not be able to live in your home any longer. And so with all that in mind, we try to consider you as a whole person and how can we help you move into this new phase of your life. In this particular situation, there's two people, right? There's the spouses that are both clients with us. And so one of them is still, quote, well. So in the meantime, while the one spouse is going and kind of switched to care management, we're continuing with those quarterly calls and the check-ins with the other spouse to make sure that their information is up to date in case they then have a medical setback.
Teresa, we're just about out of time.
Great. Well, we'll skip to the end. I think we're sending the slides out later.
We are.
And so you can kind of look through the rest of this, but
yes.
This is my contact information. And yeah, thanks for having me.
Thank you, Teresa. That's, it's such an important topic, and I'm so glad you mentioned it. And people can feel free to put questions in the chat. Teresa has to leave at 12:30 sharp, and we may run a little bit over in this presentation because we have a lot of good information. So our next speaker is Carrie Donnelly, and she's a certified dementia practitioner and a certified senior advisor with over 2 decades. You sure don't look it, Carrie. Of experience in senior living and skilled nursing. She's currently serving as the Regional Business Development Director for Montcare. And Carrie brings an excellent perspective on the connection between hospital, post-acute care through her experience her former experience and current as a clinical liaison and departmental manager. Carrie serves on the boards of the Village Support Network, the Greater Rockville Chamber of Commerce, the YMCA, and GROWS, leading initiatives that support the Village movement and address the needs of older adults in the community. She collaborates with hospital leaders across DC, Maryland, and Virginia, and serves on various committees supporting Johns Hopkins, the Healthcare Council, and the American Lung Association, where she assists in development opportunities and facilitates the Better Breathers Club. Geez, Carrie, I'm exhausted reading this. And refines program development across the Mid-Atlantic region. Carrie is committed to creating environments where older adults can thrive and ensuring communities are equipped to support aging well. There's so much confusion in the marketplace about acute, subacute. What do I do? It's an excellent reason to be involved with well care management so that you're not in a panic. And then Carrie, take it away.
Okay, thank you so much, Kathleen. Thank you for going through that. Thank you for having me. I'm very much looking forward to talking about this topic of what we call post-acute care. I'm going to load up some slides here to help us along. And because we're limited on time, I may be speaking quickly, but I'm looking forward to helping with answering any questions later. And of course, I'll share my contact information with everyone as well.
Carrie, I'll
So
cue you when there's 5 minutes left.
I appreciate that. Thank you so much. So because post-acute care, the post-acute care world is, it's a deep dive. It's a big industry and there's a lot to discuss. But I think let's start overall identifying what is the difference between acute versus post-acute care. This is what we really want to know. This is something that comes up quite a lot. Teresa had mentioned, being in a crisis and being hospitalized, and that is what hospital acute care is, and often affects us, obviously, when we don't expect it. Although sometimes we do schedule, surgeries, things like that, and it is expected. But hospital level care provides that short-term treatment for severe or life-threatening conditions, and typically it's going to take place in the hospital or the emergency department. It's short term. It's focused on stabilizing the patient. They are really focusing on treating the symptoms. I do another presentation called Navigating Your Hospital Stay, a Place to Heal, no longer in the hospital. So it's important to know that really when you are hospitalized, if it's an emergency, you are most likely very ill, and they are going to work on stabilizing your symptoms, but then in most cases in a very short amount of time focusing on that next step of care for you, meaning that your healing process is going to be happening once you discharge from the hospital. So post-acute care, and that's what we call post-acute care, which is intended to offer continued recovery and support after your initial acute care stay. And the duration in post-acute care could vary based on your needs or your loved one's needs. The focus is typically on rehabilitation, therapy, but also medical support, possibly managing chronic conditions, so that patients can transition toward a full recovery. In a lot of cases, patients in the hospital are, even though their symptoms may be treated and managed, they're no longer acutely ill. However, they may have become very weak and deconditioned simply from being in the hospital, because they are not practicing their normal routine and their normal mobility. And so we were finding that most people are being recommended to post-acute care, and that could mean different things. So let's talk about that. The key differences first, obviously, acute care is high intensity, dealing with immediate health crisis. Post-acute care is meant to be a step down, focusing on recovery and stabilization. And where acute care aims to save lives and stabilize patients, post-acute care supports those ongoing recovery needs and is intended to promote independence. Care providers often involve specialists in emergency medicine and surgery in acute care, but while post-acute care teams are typically therapists, nurses, possibly primary care providers that are specializing in rehabilitation. So if you're being recommended for something called subacute rehab or skilled nursing and rehab, that is one type of post-acute care. So in many cases, if you have a loved one in the hospital that's being recommended for post-acute care, they may offer you different options. And a lot of that has to do with the care team at the hospital and some of the therapy recommendations and assessments. In many cases, I'm sure, I can't see your hands, but you may have known someone or work with someone who has been approached by a case manager within the hospital who has said, you've been evaluated by the therapy team, and we believe you need to go to a rehab facility. And now, what does that mean? What does that mean? Because in many cases, most people have not prepared for that option. And it's usually recommended if you need more care after your hospital discharge than can safely be provided at home. In some cases, post-acute care can mean going home with home care therapy and support. But a lot of times that may depend on the level of support you have at home. Teresa had talked about solo agers. So, your environment as well has a lot to do with your capacity to be able to really recover and improve at home. So keep those in your mind, that information in your mind when you're considering what the next step of care is. Patients that are admitted to subacute rehab or skilled care should be able to participate in up to 2 hours of rehab per day, and they should be able to show signs of improvement to qualify for ongoing treatment. And that is very important because that is really how they determine when the therapy team comes to evaluate patients, what level of therapy they're making recommendations for. Because there is another level of therapy called an acute rehab level of care, which is a hospital level of care. And that's another conversation that we can dive deeper into at another time. Because I do some presentations actually discussing the differences between an acute rehab level of care and a subacute rehab level of care. But we're talking about subacute, so let's get into that. So subacute rehab is physical therapy. We're talking about up to 2 hours of rehab per day, and then also possibly skilled nursing, which might include post-operative care or complex wound care, possibly IV antibiotics. A lot of people get admitted to the hospital because of an infection or sepsis, and they need infusion services that maybe going home with support is not the right fit for them, but they need additional therapy to help them recover. And in those cases, they'd be recommended to subacute rehab. And then possibly people who have additional, more clinically complex needs like feeding tubes and tracheostomies as well. So I wanted to include this because I think this information is very important. These key pain points for patients and families I have seen over the years, they're basically, questions about how to make these decisions, wise decisions for us, individualized decisions for what our needs are. And I understand, and most of us do, that there's some confusion again about the different types of rehab options that are out there. What do they offer? Which is more suitable for my loved one's condition? And then the urgency and pressure that we feel when we're at the hospital, being rushed to decide quickly. Often, they're in the hospital and the day before they are being discharged, they're giving options to choose a rehab facility or center to go to. And they're being asked many questions about their home environment to even consider that option as well. They're being overwhelmed by the amount of information that's being given to them. And they're not knowing how to interpret it or who to trust in that information. They have quality of care concerns. They're worried about the quality of care and the competence of the staff at the rehab centers that they're being referred to. There are financial implications. They're worried about the costs associated with rehab and what the insurance coverage might be and the potential out-of-pocket costs. And the stress of finding a center that's conveniently located to their family, which can impact the overall support someone receives. And I'm going to speak on that very soon here as we talk about really how to pick the right place, the right center for you. Cultural and language barriers obviously play a part in decision making, as well as your transition from hospital to a rehab center and then back home again, including how well the different stages of care will be coordinated, and then post-rehab support, which is the uncertainty about what happens after rehab. So all very important information to consider when you're making a decision. how can skilled nursing or subacute rehab help? And this is when we talk about some of the things that could benefit you, your loved one, your family, is the opportunity to recover from a physical decline, preventing another possible hospitalization or crisis from happening. I see many times patients that choose to go home and typically are readmitted because of a chronic illness or debility when they needed rehab and they weren't necessarily able to get the right therapy in the home, able to recover at the right level in the home because of limitations. And we have direct admission opportunities for those. We actually collaborate on the continuum of care with home care agencies to assist in folks who are home and trying to help them obtain rehab from home versus having to wait for a crisis and be hospitalized again. Specialists can offer and develop full assessments. They can develop goals and they can make recommendations for follow-up and care to ensure you're at the best when you return home. It can also offer time for your family members to determine that next level of care or to prepare the home for their return. Most patients or family members are looking for a place, sometimes just temporarily, where their loved one can improve over a short period of time, but also giving them some time to prepare for that next step, Teresa, if they haven't pre-planned, as you suggested. What to expect. So let's review this real quick because this is important, I think, overall, when we get to how to make the decision, because it's important to know that all skilled nursing and rehab centers offer a team of recovery and support within them. There is a medical director and often specialty doctors in-house in skilled nursing and rehab facilities, often internists, wound care physicians, palliative care doctors, and physiatry physicians as well. Sometimes even cardiologists and pulmonologists will come out to skilled nursing facilities and consult on patients and do also peer-to-peer consults. So if a patient has a cardiologist and there's a cardiologist at the facility, they can peer-to-peer with each other to make sure that they're on the same track in terms of the care needs of a patient. There is a licensed nursing home administrator, which is an operator of the building. There are admissions teams, business office managers, medical records departments. There are nursing specialists, it consisting of a director of nursing and an assistant director of nursing, as well as other clinicians. Usually most facilities have nurse practitioners on site, RNs, LPNs, and CNAs or GNAs as well. There are nursing administrative teams, housekeeping and maintenance teams, social work department, typically more than one social worker, dietary department and a dietitian, and of course life enrichment teams as well as a director of rehab and other therapists. So very well staffed clinically and also across other functions of the center.
Carrie, you have about 2 minutes.
Okay, so I'll skip the covered know your benefits part because I think this is something that you all could look up on your own. But if you go to Medicare.gov, you can look up information about how your Medicare covers for post-acute care, and you can learn more about Medicare Advantage products and some of the limitations there, Medicaid, private health insurance, and VA benefits, okay? And I think we'll share these. Medicare Basics, I'm hoping that you all really take note of what your coverage is with Part A, B, C, and D. I'm going to skip over because I felt that we have a good understanding of that. But I think here, let's just touch on this real quick. Kathleen, what's important to you? Okay, so many times I'm going to speak from experience. When you are interested in learning more about a specific skilled nursing facility or post-acute care center, take note, write a list. I'm actually working on a clinic with a senior center on this about what is important to you. What is important to you before you take a tour, before you pick up the phone and talk with someone about. Is it the quality care of the center, the star rating of the center? Is it the expertise of the staff? Do they have specialty clinicians? Is it the environment? Do you prefer an environment that has more amenities, perhaps newly renovated? Is it the location to your home? Patient outcomes, are those important to you? Cultural and language needs, and then also cost and insurance compatibility, because in a lot of cases, if you have a Medicare Advantage plan, you are going to be limited in terms of your choices. And then ask the right questions, because when we get inquiries, I will say too many times, you know what people are asking? They're asking these questions. You know, who do you have on site? Do you have a dietary department and a dietitian? Do you have life enrichment activities? Oh, I'm telling you right now, we do. Everyone does. So ask the questions that maybe pertain to what's important to you when you're touring. Can we tour the entire facility? What doctors are actually credentialed here? Make note of those doctors. Are they nearby? Right? How many patients, instead of asking, how many patients do you have? How many rehab beds do you have? Because a center will tell you what their capacity is. They might say, we have 110 beds and we're duly certified. And we have a mix of long-term care and short-term rehab residents. Instead, maybe ask, how many patients do you discharge home every week? This is an important question, because you're going to find out, are they maybe a top tier center in rehab? Do they admit and discharge patients from their rehab weekly at a very high level? You can compare these numbers from one center to another. I think this is important to really get a sense of the type of center that you're talking to. Okay. What are some of the most common grievances? Ask them. Evaluate Google, but don't let those online reviews take the place of communication and a tour. And then really, really commit to, again, taking note and rating what is important to you. Is it the location? So if you find a center that's located close to your home and you know that you will be able to visit quite often, is it necessary for you to choose that 5-star rated center, because that center might be 30 miles away from your home? So take a note of all of those things, rate them based on what's important to you, and then decide, after you ask these important questions, what center might be the best fit for you. And you might be surprised. There are many centers out there. We can do a deep dive on how to evaluate them based on their care ratings and quality indicators, which are very important. But at the same time, it's important to take into account your personal needs. Can families join residents at meals? What are their visitation hours? Are they strict at visitation hours, or do they allow you to come in at any time? And these are things that may differ from center to center. What community partnerships or programs do they have that benefit the residents? Every center may be different in their community partnerships. Some may be more involved in outreach and others may not. And how do they involve families in care planning? Are they calling families or care planning for a rehab resident within the first week, or do they wait a few weeks before they do so? Data and resources. So here's some information. AgingLifeCare.org is a great place to go for a life care manager. CMS.gov has some fantastic information there about your insurance benefits. And Medicare.gov Care Compare is a place where you can go and type in zip codes and really find the centers that are closest to you, evaluate their ratings, evaluate their latest surveys, and try to get a sense of whether that feels like a good fit for you in terms of skilled nursing and post-acute care. Prepare in advance. So, Kathleen, are you giving me the red flag?
I am.
Okay.
Sorry.
Prepare in
but-
advance. Prepare. Teresa, I know, would advocate for that. I think Erin too. And then know your coverage limitations. Really important. rights and responsibilities, understanding those, and then what to look for. Kathleen, if I could just take a quick minute just to kind of promote Mont Care. In our centers, we have 4 locations in Montgomery County: Potomac, Wheaton, Montgomery Village, and also Bethesda. And they're all top rated, and we have some specialty programs there. Again, something to take a look at. If you're a dialysis patient, we have on-site concierge who helps provide sort of an additional one-to-one personalized service. And so you can ask about those things that might be a differentiator from one center to another, testimonials as well, and payers. Are they in network with my plan? The direct admit program as well. You can take a look at that later. Ask them if they have a direct admit program that would allow a loved one to come in from home if needed for a short stay, typically 7 days, and typically all inclusive at an extremely reduced rate.
I didn't know that. That's good. That's good to know.
Yeah. All right.
Well done,
Thank you.
Carrie. Thank you. And of course, we could do an entire hour on the nuances of rehabs, and maybe I will ask you to speak with one of the villages that I work with, because it's a tremendous amount of information. I do have a couple questions, which we'll save till after Erin's had a chance to do her presentation. And if we need to go over, that's fine. Everybody can stay on the call, but I know that Teresa has to leave. And we will certainly be happy to send you the presentation if you send us an email that you would like it. So our next speaker is Erin Pickrell, the director of Griswold Home Care for Chevy Chase. She's a certified dementia practitioner and a certified senior advisor. She also serves on the board of directors for the Bethesda Chevy Chase Rotary Club, which reflects her commitment to community engagement. She's an active volunteer with local villages and has served in leadership for the Greater Bethesda Chamber of Commerce. She also participates in the GROWS grassroots organization for the well-being of seniors. And Erin's passion for home care, I love this part of her story, began early as she grew up and immersed in the industry through her mother's Griswold Home Care Agency in Delaware. So after spending several years working for a nonprofit organization in Costa Rica, Erin returned to her roots and acquired her own Griswold franchise in 2020, which was the beginning of COVID. What a great time to start a home care company when you can't go into anybody's home. So congratulations to you, Erin, for surviving that experience. Since then, she's dedicated herself to building a thriving multi-million-dollar business. In addition to her professional achievements, Erin lives in Kensington with her husband and an 18-month-old son, balancing the demands of entrepreneurship and family life with grace. So, Erin, obviously you don't sleep very much. So thank you for coming online to tell us about this very exciting hybrid home care option, which I really do believe is the wave of the future. So don't go away, everybody. We're going to do Q&A after Erin's presentation. So stay tuned. Erin, take it away.
Of course. Yes. Thank you for the introduction, Kathleen, of course. And thanks to our other presenters. And I can make mine relatively quick to allow for some questions. And so I think our presentation, we wanted to talk about the Well Senior program and then potentially that care management that you might need in a crisis when you do go to that subacute rehab. And now, the idea would be that you're discharged home. And so I'm going to talk about some technology that can help you stay safer at home, along with, the professionals, caregivers, that PT and OT that is often comes home with you as well. And so as a review, I'm going to talk about virtual care, some wearable devices, and then that remote monitoring, smart home technology, and artificial intelligence that is getting bigger nowadays. And I took some inspiration from Teresa and also did a pet appreciation slide. I also, in addition to my son, have a dog, Matza, and a cat, Jupiter. And we definitely, they tolerate the 18-month-old, and it's fun. It's a fun household. And so then technology obviously is a huge part of our life that is not news. We in healthcare, obviously the COVID-19 pandemic accelerated the adoption of that virtual care, telehealth visits, people being really comfortable talking to their doctors and other care professionals online, video, phone calls. By some estimates, those visits grew by 3,000% from 2019 to 2020, which I think no one would be very surprised by. And as of now, in Maryland, 3/4 of physicians work in practices that offer a telehealth option. We're aware it's convenient, cost effective. It's also accurate. They've done studies where it's those diagnoses that come on the phone are 90% accurate to what is diagnosed in person. And then a lot of us have and use daily these voice and video technologies. So for example, Amazon Alexa or Siri on our phones. Echo Show are, video devices that can connect with not only social media, but can connect with loved ones, or emergency services providers as well. And then of course, FaceTime and Zoom helps us connect with our loved ones and, keep in mind what's going on with those that, might be far away. And then we've always had devices, personal emergency response systems, the kind of what we think about when there's the I've fallen and I can't get up button. And then, of course, those have advanced in the last few decades. There are smartwatches that have fall detections, activity trackers that can alert a loved one if there is, less activity than usual. And so all of these are really wonderful technologies. And what I'm going to talk about is more the smart home and remote monitoring aspects. So everything can be connected to Wi-Fi nowadays, which can be, your alarm system, your smoke detectors, heating and cooling. There are water leak detectors, your lights, your blinds, your kitchen appliances can all be connected to Wi-Fi, which can be really important when, maybe someone has dementia and you're not sure if the oven is always being turned off. That can be connected by Wi-Fi to not only the resident, the person who lives in the home with that oven, but also like their loved ones so they can check in. Even I added this, scheduled the feeding for pets if you're worried about someone remembering to feed their animals, that can be scheduled online and usually with a device. And really, cool in relation to home care and kind of coming home after an incident is, locks. So if you are having people come into the home to help you and you're not able to get up every few hours to let them in, you can have a lock where it's a code and you can give people that code. And then if for whatever reason, you can always change that code too. And so that's a great technology that can be really helpful. There are several different options for pill dispensers, and they're often expensive, but of course, if you are living alone or your loved one is living alone and needs that oversight for medication management, which is such an important part of recovery, you can purchase or subscribe to these pill dispensers that can also be monitored remotely by a caregiver who might not live close, or even a spouse who does live close but needs to know what's going on with the medication. And then, of course, artificial intelligence is another big trend in home care and helping seniors stay safe at home. Even, of course, in the communities that we work in and are familiar with, they are starting to have Alexas, video cameras, things like that to make sure that their residents are safe 24/7. Of course, like this type of video or audio system really helps with the staff shortage and controlling the cost of care, because it's a very cost-effective way of having that 24/7 understanding of your physical, emotional, and cognitive needs. And so my agency, Griswold, has implemented a technology called Sensi, which is I can't see myself, but which are essentially these pods. There's as many pods as you need to cover your home, and we install them. The installation is very quick, and it's really plug and play. After we install them, it uses audio data only to detect all of these things. So major falls, crashes, calls for help. If someone is saying call 911, our office staff is alerted immediately, and then we can take action. That action means different things for different clients, but it can be, of course, calling them, checking in, possibly calling 911, calling a neighbor or loved one who can check on them. And that is determined with each of our clients. And so then, I guess in the next slide, it detects lots of different care interactions, Sensi specifically, but there are other technologies that are, similar and are being used. Sensi specifically can detect early signs of pneumonia, UTIs, care resistance, cognitive changes, medication errors, and then, of course, those emergency events. So I think we use the example a lot that if the client begins to use the bathroom a lot, a significant increase in using the bathroom, we can say, hey, you might want to go to the doctor and get checked out for a UTI. It's not a diagnostic tool, but it can definitely help catch those issues and provide intervention before it turns into something more complicated. And so in terms of, we're a little bit low on time too. So I will finish up with this slide really, but yeah, and so I think I'm really excited. Of course, the falls, the calls for help are so important. There are great case studies where a Griswold agency, detected a fall on a Saturday morning. The caregiver wasn't going to come back until Monday or Tuesday, and so they were able to get that client the help they needed within hours instead of days. And that's so important. But I think what I get really excited about is these smaller, kind of less flashy case studies where the system detected that a client was waking up at 6 a.m. and calling for help, and the caregiver wasn't supposed to get there until 7. And so when the caregiver got there at 7, the client is upset. They've been calling for help for an hour. And so those are just, you just move the care hours to be a little bit earlier to really adjust to the client's real life immediate needs. We've had a few clients who are complaining about sleep issues, and maybe they're not verbalizing that to their family, but they're verbalizing it overnight. And so then we can say, hey, let's get this checked out and get it taken care of. And that is obviously so helpful to have that peace of mind at night that your loved one is sleeping well. And then, as I spoke about, the detecting falls, able to intervene and get help, within hours instead of days, which can be a huge differentiator for that client's quality of life and quality of their recovery. And I do have one last slide. Of course, this is my contact information. We will share this in these slides. But in addition to Sensi, we do provide, live-in care, hourly care. We can adjust the care plan to meet your needs during your recovery, coming home from rehab. And Sensi is always included in that care. And I'm happy to answer any questions or have any questions from the group for the others as well.
Thanks, Erin. Great job. Yeah, it's a really exciting, innovative product that's coming online. And I think it's just a great tool, an added tool. We do have a few questions from folks. So I am going to go back to the beginning questions for Teresa. No, Carrie. Carrie, let's see. Eddie says, Eddie, I'm not sure about your question. Does the patient do the review or does the care manager? Eddie, are you still on? Can you clarify that question? Eddie or Edie?
Yes,
Edie.
it's Edie.
Edie.
What I meant was Carrie was speaking about reviewing the institutions, and it sounded like that would be up to the patient, but is it by he or she by themselves, or you, if we did Aging Well, would you go along with us, Teresa? I don't understand how that would happen.
So initially, if you're hospitalized, the assessment would be done by the hospital team to make a recommendation that they feel is the best fit for the person and their clinical needs and recovery. And so there's a specific criteria that they'll follow in terms of making a choice between subacute rehab and an acute rehab level of care. And that's very different in terms of maybe someone's ability to tolerate a more aggressive level of care, which would be an acute rehab level, say like the National Rehab Hospital or the acute rehab hospital over by Shady Grove.
Right.
And then when you're making a choice, let's say they've given you a recommendation for subacute rehab, then it would be your decision, the family, patient, loved one, to decide where they would choose to go. And that is completely up to the patient themselves and or whoever they're designating, their designated advocate to make that decision. Sometimes they'll give you some recommendations, maybe a list of facilities that are within your zip code that maybe you've requested, but they're asking you to make that choice.
And that is where care managers can also help, because people can find that choice really overwhelming.
Right.
And I think I saw another question or comment in the chat, and I'm not able to find it now, but that the hospital social workers either
That was me.
aren't able to. Okay, yeah, like they're either not able to, or they're just not aware of like what the actual communities are like. They're in the hospitals all day. They're not out visiting and touring these rehabs. They might have like liaisons coming to talk to them, but they're not there to see what they're like. So care managers in our company have staff in and out of these communities every day. We're interacting with them for discharges and for other reasons throughout the week. And so we can give a good idea of, based on what you're wanting, location, care needs, maybe there's some specialized care that you're wanting, and maybe there's only a couple options locally, but there's another option over in Howard County. And, what would the care be like over there? And so we can help guide people on that. But usually what happens is the social worker is going to give you a printout of a lot of options. And maybe they'll circle some based on some criteria. And something else that can sometimes happen is you pick your top 3. Maybe you have a top 1, but they hear back from your number 3 option and they never hear back from number 1. So they go ahead and tell you that you're accepted at number 3, go ahead and go there. But really, you still have the chance to find out if number 1 will accept you.
Okay,
So there's
great.
a lot that goes into it.
Great. That's exactly what I wanted to hear, that we could get help from you all if needed. Yeah,
Yep.
great. Thanks.
Yeah. You know, it in my experience from my mother, father, and husband, I found most social workers reluctant to commit to a rehab specifically for a lot of different reasons behind the scene. And I didn't find the list particularly helpful. So having an advocate who is knowledgeable, sometimes care manager like Teresa's firm is really useful. My husband was also at Monk Care in Potomac as a frequent flyer. We should get bonus points, but he was there 3 times. It was lovely. It was just great service. And, you know, talking with people in the industry, I know Erin is, you know, her caregivers are in lots of rehabs and variety of health-centric places. And it's really helpful to get other people's input, in my experience.
Mine
And
too. Mine too.
yeah, yeah.
It was not a good experience, not personally, but with friends. And I think that's a critical time for help.
Yeah, and you have to be brave and speak up. Social workers and care managers, discharge, they're busy and they're
That's right.
overworked, they're
That's right.
underpaid. Well, I don't know about that, but anyways, they you know, sometimes just exactly that happens. What Teresa says, where I want to go to XYZ and they say no, because they didn't answer. So
Right.
you know,
Right.
advocate for yourself. A professional advocating for you can make a real difference in uh, in a lot of health care situations. The
Thank
other
you
thing
so
I'm finding with clients, I have an elder care a consulting company, is that Sensi, you know, if the patient really, you know, has 12 hours of care at home and they have the Sensi product in for the, say, 9 p.m. to 8 a.m. shift, having that electronic device. My husband, who had dementia, frontal temporal dementia, you know, he wouldn't wear a device. And, you know, having a pod that's a listing device that will alert the home care company there's an issue is just a real new innovation and a great service. And Griswold provides it free of charge to their clients. So there's not even an extra cost, which is
Wow.
always helpful in this. Healthcare is expensive. Okay, do we have any more questions out there? You can unmute yourself. Just want to mention, if you're not reading in the chat, that Teresa recommends, what did you recommend, Teresa? Oh, the Hero pill dispenser.
Love the Hero.
It's amazing. It's
And
really
MedMinder.
Yeah, there's another cool one called MedMinder that's really helpful for people that maybe don't have someone overseeing them to make sure they're taking. What happens with Hero is it drops it in a dish. So if you're not taking it, next thing you know, the next dose might drop in the dish. So for some people where there's not someone observing them all the time, the MedMinder has like locked doses. So it'll open for a period of time and it'll lock itself if you don't take it. So you're not accidentally double dosing, which is really neat. But they both have really similar cool features where it will ping you, it will alert you if the person's not taking their meds or following through with what they're supposed to be doing.
That's great. Anybody? Let's see. I live, somebody, Barbara Zimmer, can't see the last name. It says, are your services available in Alexandria or Arlington? Barbara, who's that question for? Is that for care management, rehabs, or Griswold?
well, and I think everyone can answer. I mean, essentially,
Might as well.
yeah, exactly. Go ahead, Teresa.
No, go ahead.
Just that essentially, yes, we are available in Alexandria and Arlington, and you can absolutely, give us a call and we can get you to the right person. There are definitely Griswold home care is available.
And our services for aging well elder care, unfortunately, we don't serve Virginia. We're in Washington, D.C., and then the surrounding D.C. Metro Maryland counties, all the way up to Frederick in Western Howard County. And but because we're part of the Aging Life Care Association, we know plenty of care managers that have their own businesses out in that area. So if you need a care manager in that area, you can either go to aginglifecare.org, or if you want to call us and say, I'm looking for services in that area, our office staff will get you connected to either a personal care manager that we know out there, or we'll look from the list if we don't know someone personally.
Okay, John wants us to repeat the email address for request for the slides. Aaron, Aaron will send out an email to all registered participants, giving you each person's contact info, and you can email that person directly. Concordia provides care management services.
Nancy is here from
Yes.
Concordia, so they also serve Virginia.
Okay. So that's another care management company that serves Northern Virginia.
Hi, Nancy.
Hi, Nancy.
Hello. Thank you for this great discussion.
Yeah.
You're welcome. Do we have anybody, any other questions that would like to speak up now, or we're going to close out this session in just a minute? Okay, Carrie's put her information in the chat if you would like it right now. Anybody else out there? Okay, well, thank you very much. Carrie from Montcare, Teresa Boring with Aging Well Elder Care, and Aaron with Griswold Home Care of Chevy Chase, Kensington. These are really important topics, and I know everybody just touched on the surface, but people can give you a call, and I'm sure you will be happy to speak with them about their more personal questions. So thank you all. We appreciate your attendance, and see you next time.
Go and take my hand now and make it alright. Let's be honest, we got this, and I got you.